It started 19 years ago when I was pregnant with my oldest daughter. They seen that I was spilling a lot of protein in my urine. And then after seeing a lot of kidney doctors, being on different types of blood pressure medication, dealing with stress, on top of that, that drained and strained my kidney as well. That's when my numbers started going down from there. Oh, it was a mental challenge. I would have to do dialysis. I did hemodialysis at night, so I was on my dialysis machine for 8 hours every night, and then I would get up and go to work a full-time job, take care of my 2 daughters, and do it all over again the next day. I received my transplant October the 11th, 2020.
So I'm one of the nurse practitioners with the kidney transplant program here at MUSC. There's, I think, about 8 of us currently, 4 APPs, advanced practice providers, and 4 doctors. And we kind of break the state up into 4 different sections, as well as our out-of-state patients. And we see patients 6 weeks after their transplant. So as nephrology providers, we kind of take over from the medical side of things post-transplant. So Ms. Watkins, she's about a 2-year outpatient who is a fantastic patient to have. She lives in the upstate, and she had her transplant during the pandemic, and so a lot of her care has actually been completed through the telemedicine program that we have. So, her first few weeks after transplant was here at MUSC, and then she was able to return home and do most of her visits from a telemedicine perspective.
I was still traveling to Charleston, and then after a period of time, then it was presented that they would be able to do telemedicine from home. So I would see my doctor, I would have my cell phone on my computer and have my visits with him on there until they opened up the office in Greenville.
Our Greenville, it's a transplant outreach and telehealth clinic located in Greenville, South Carolina. We have numerous clinics like this kind of all over the state. The unique thing about Greenville is it's the furthest away from Charleston. We typically service our upstate transplant patients, both pre and post-transplant, as well as our out-of-state patients, including areas like Western North Carolina, Tennessee, and even North Georgia. Well, a unique aspect of this is it's full-time staff available. In many cases, we're reliant or dependent upon outside labs, but we can do all that here in the office.
Through telehealth, basically everything that is done in a regular clinic here on the Charleston campus, we're able to, specifically for our transplant patients, do their medication titrations. We're able to adjust their medications. We're able to counsel them on their diet and what they need to eat, what they need to eliminate from their diet. We're able to do weight loss counseling. We're able to do blood pressure management, and everything that can be done at MUSC Charleston can be done through our telemedicine clinic.
Telemedicine has been an integral part of this clinic since it was opened by MUSC. We partner with the Telehealth Center of Excellence, which is one of 2 nationally accredited centers that's located at MUSC. And really, they help facilitate our care with our Charleston providers and then our patients here in the Greenville office.
It played a major role in my transplant because I would have to travel to MUSC. It would take me like 3.5 hours to get there. So I would have to leave Gaffney pretty early to make it there. So with doing telemedicine in the comfort of my home, it made a big difference. Best part is to be able to have that one-on-one with my doctor and be able to have that conversation about what's going on with my kidneys or any concerns that I have. My doctor was on it, and it was amazing doctors at MUSC that I seen.